About 2 weeks after the implant procedure, your ReActiv8 system is activated. You'll receive instructions on how to turn on the therapy using a handheld remote. After that, your doctor may only need to check your ReActiv8 system a few times per year, or when you feel it might require an adjustment. Most patients start their twice daily 30-minute therapy sessions in the morning before they get out of bed and at night when they go to sleep. Based on patient data from the clinical trials, many patients experience a noticeable reduction in their low back pain after several months of therapy. And even after their low back pain significantly improved, most patients chose to keep using their device. And if you and your doctor decide that you no longer need ReActiv8, the system can be removed by your doctor.